Welcome back. Pillow face is a common cosmetic concern, but it doesn't have to be permanent. In this segment, sponsored by Gotham Plastic Surgery, we're joined by Dr. Philip J. Miller to share how you can fix it. But first, what exactly is it? What is pillow face?
Yeah, you know, sadly, we've seen it, unfortunately. It's an overinflation of the face, often caused by just injecting too much filler in the face. As we age, we lose volume. We want to restore that volume, and sometimes we just can take it a little too far and request too much to be injected.
Yeah, we were talking just a minute ago, and you gave a really good analogy of a contractor and an architect. When you're going to a plastic surgeon and you want a certain look, who are you really talking to? Who's going to do the job?
Yeah, that's a great question. You know, you're talking at first to the architect. You're trying to convey to the architect of the facial plastic surgeon, this is what I want to achieve, and then you're relying on that architect to switch hats and put on the contractor hat and actually execute the procedure. And all too well, there are some individuals, some very, very talented physicians who are more the contractor and less the architect, who will hear a patient's request, not take into consideration the aesthetics, and just perform their request. They're doing what the patient's asking, but maybe the better solution is to tell them, no, you're overfilled, you don't need anything more.
So if you're finding the right plastic surgeon, then hopefully you're getting an architect and a contractor.
You want to get both.
Because
exactly.
You want somebody who can say, yeah, I know you want that much filler, or you think you want that, but I don't think it's going to look good in reality.
Exactly.
Do you think that sometimes these people who are getting this kind of pillow face look, that maybe they're getting acclimated to what their face is looking like and they just keep wanting more and more?
Yeah, they get a certain kind of hit, you know, that dopamine, adrenaline hit when they look and they see the larger, and then that kind of goes away and they don't see the aesthetic result anymore, and they want that hit again, so they're going back for it when in fact they look terrific and they need to be reassured that they do, as opposed to just abiding by their wishes and injecting more. That doesn't do them any justice.
So in practice, an ethical plastic surgeon might say, hey, I know that you want this. Let's talk about the look that you're looking for, and maybe kind of turn it back toward them, kind of counsel them through that.
Exactly, and I tell them all the time, if you want more, come back to me so I can tell you you don't need it, okay? Because you will find someone who will do it. That doesn't mean you should do it.
Absolutely. All right, so that's really, really good advice. If you are looking to get filler, what's the right way to do it? Because I've heard people say, get Botox, but don't ever get filler. And I don't think that's necessarily true.
No, you know, I mean, each one is doing a different role. The Botox is numbing muscles that are responsible for creating wrinkles on the face, and filler is filling depressions or soft tissue loss that we develop over aging. And a certain amount of filler is good. There's nothing wrong with it. It can't do everything. Every single procedure has its limitations. Sure.
And eventually we all are going to age.
Yes.
So this is kind of slowing things down or making it look good while we do.
Correct.
You mentioned that Botox and filler have different roles, essentially. You said Botox helps kind of prevent the wrinkles. Does filler fill in wrinkles?
Not really. It can. Very, very fine filler can be injected into fine wrinkles in order to efface them or actually flatten them out a little bit. But the fillers that we're talking about nowadays are really for volume restoration, where you don't have cheeks or you're getting a deep nasolabial fold and the like, or the marionette lines. That's how filler. In the old days, back when I was first training, the only filler that existed was collagen. Lasted for 4 weeks. It was typically done in these fine lines, looked good for maybe a week or two, and that was it. Now the fillers can last several months.
All right, so good information there. If you are looking for someone who will tell you what is going to look good while trying to abide by your wishes, Dr. Philip Miller is going to be your guy. You can check him out at his website. Thank you so much for all that good advice.
My pleasure.